Good afternoon, everybody. Afternoon, Virginia. It's 4 o'clock. That time we come together about 3 days a week. And remember that we're going to get through this, and we're going to get through this together. Today is going to be pretty short. We're having to move our vaccine update to Thursday for a couple of reasons. First, the federal government has not updated what our allocation is going to be next week for at least one of the vaccines. And second, we believe we're going to have a major announcement on Thursday, which will give us a chance to talk about it all together. I'm happy to answer questions about it from those that have them at the end, but we believe that the Thursday update will be significant and more informative then. We will also give a UI update then. So Thursday will be long, today pretty short. All right, first, today, we began to provide the dollars that I promised at my State of the Commonwealth to those that have been waiting too long for unemployment payments or who were unfairly treated by the federal government during some of the summer assistance. That is the use of $48 million in CARES Act funding for two groups. The first group are those that applied between March 1st and October 31st for unemployment that are still unemployed. That means that they have been waiting multiple months, have not received a payment, and don't have any issues of fraud or identity. Those individuals will be receiving $1,000 to help them get by. They've waited too long. That's a failing on the fault on the part of government. And again, we want to help these people until we can get to their claims. The second group was the group that did not qualify for the extra $400 supplemental payment over the summer because they made too little, because they were already working poor, working regular full-time jobs, but still didn't make enough to qualify for that program. They will be receiving $400. Further refinement of the claims. Looks like there are about 16,500 individuals that will receive the $1,000 payment and about 25,000 that will receive the $400 payment. They are single payments made only once to the claimants, but a chance to help people out. All right, we're going to dive right in to our COVID update. Today, we're reporting 3,053 new cases. That is the fourth highest Tuesday. It's higher than the last couple weeks. It's pretty close to about 3 weeks ago. So again, we're trying to determine where these numbers are going. We believe that it's first, we are sure that this is a surge caused by gatherings through the holidays, but there is a chance in what we are seeing in the data that while people gathered in the holidays, that maybe now they've changed their behavior back to being very careful. If that's the case, then hopefully we'll see a leveling off, but only the data over the next couple days and into next week is going to let us know. The hospitalization numbers just up a little bit, 1,733 individuals in the hospital for COVID, 397 in the ICU, 205 on a ventilator. That's actually down too. Our positivity rate, 12.23%, also down a little bit. I think one important thing to note is while 12 is way too high, it has been in that 12 range now for several days, when before it was going up and up and up. So again, way too high, but we at least hope that this is a sign of it leveling off. New cases by county: Jefferson 368, Madison 142, Kenton 139, Fayette 138, Boone 94, Warren 90, Pulaski 84, Pike 70, Davis 66, Campbell and Wayne 62, and the others can be found on kycovid19.ky.gov. Sadly, we've lost 22 additional Kentuckians that we are announcing today. Far too many. There are a number from Boyle County. This is going to be in part, it looks like, because of a lag in reporting. These did not all occur in December. Some are back a couple of months just for Boyle County. So 7 individuals, all men, ages 51, 63, 66, 71, 78, 87, and 88. 3 of those individuals were in corrections institutions, and we've while we've previously reported the loss of life in those institutions due to COVID-19, this is where the report comes in on the data on death. 2 individuals from Carter County, a 76-year-old female and a 78-year-old male. A 60-year-old from Harrison County, a 61 and a 75-year-old, both women from Hopkins County. In Jefferson County, a 56 and a 97-year-old woman, and two 78-year-old men. In Jessamine County, an 80-year-old male. In Lewis County, a 73-year-old man and a 74-year-old man. In Muhlenberg County, a 69-year-old man. And in Pulaski County, a 43-year-old woman and an 83-year-old woman. 22 individuals lost are a lot of people to lose, and that means that there are a lot of hurt families tonight that are going to need your help, that are going to need you to reach out, that are going to have to mourn at such a difficult time to do it and lay their loved one to rest at a time when they can't do it the way that at least we used to. So please light your homes up green. Please keep ringing those bells. There's somebody out there that needs your help. Long-term care facilities, 71 new residents testing positive, 53 new staff members, 28 additional deaths attributable to long-term care. All right, finally, before we move to questions, we've been talking since the attack on the U.S. Capitol about those that would bully, those who would intimidate. And we've also talked about fanning the flames of hate and of anger, and that we have a responsibility to not allow that to happen, and certainly to not lift up and support those who would engage in it. Well, those who engage in it don't just rally. They also do things like filing petitions for impeachment. I learned today just who some of the individuals involved on that are, and I cannot believe that a part of our state government would and shouldn't support those that have engaged in activities of intimidation and of hate. I just want to show you a little bit of what I mean. So one of the people that signed the petition is Jacob Clark. This is a video on Facebook where he says that God is going to smite me, and that is his handgun right above his left shoulder. Pretty sure the statement he was trying to send to me then. But maybe he could have been more direct about how he feels about others. Can we show the next one? Yeah, this is him supporting politicians being hung. This is exactly what we saw in D.C. These are the people that are out there trying to undermine our democracy in any way that they can. I didn't know the next one because it's fairly personal, and I think y'all can understand why. Another individual, his name is Tony Wheatley. He is the one that put together the rally where the 3 percenters hung me in effigy. He's the one that put together the rally where they stormed past all the barricades in front of the governor's mansion and stood on the other side of the windows from where my kids play. He's also the individual that helped organize this last weekend where heavily armed individuals showed up, showing exactly what they intended to do. This individual has the zip ties on the back of his camo gear, his tactical gear, which of course was also carried into the U.S. Capitol, and we know exactly what they're used for. These people who signed this petition have tried to create terror for me and my family before. And when that hasn't worked, I guess they're trying something new. We cannot, as a country and as a government, lift these folks up. It is dangerous. It is fanning the flames of their hate and of their anger. And whether this was something filed against me or anybody else, going out there and playing patty cake with these so-called militias that stormed our U.S. Capitol and murdered a D.C. Capitol police officer and that put everybody else in danger is just wrong. All right. With that, we'll take questions. We'll start with Tom Latek from Kentucky Today.
All right. Thank you very much, Governor, and good afternoon to you. Talking about those 4 people that signed the petition, is there an investigation underway to see if any charges can be brought against them?
We're waiting to see whether charges can be brought against them. Not to my knowledge. Not to my knowledge. But I do think it's pretty clear when somebody makes a video saying God's going to smite you and you're brandishing your handgun, what you're trying to tell them. I think it's pretty clear when you hold one rally and people basically storm the front of the governor's mansion, and so you hold another one X number of months later with the same people. What you're trying to do and how much concern there really is. I mean, we saw how dangerous this could be back in July in Kentucky, and then we saw what happened in the U.S. Capitol, and now we're supporting this afterwards. We're in a dangerous place and time in our country and in our state, to the point where we are having to significantly elevate the security around the Capitol, again, in part because of at least one of these individuals. That's putting everybody at risk. Catherine Collins from WLEX.
Thank you, Governor. I have 2 questions. The first is on vaccines. We learned today that the federal government is no longer going to hold back those second doses. How will that impact distribution here in Kentucky, and will that affect people's ability to get the booster shot? And on those, you talked about having plans to protect the Capitol yesterday. Have there been any specific plans for protests at the Capitol coming up in the next week or so, or any specific security threats that you've been made aware of?
There is at least one gathering being planned for the 17th. 17, the number, it has importance to the QAnon folks. That one is public out there. I think that date is also one where we think we will see things in other states. On the vaccine front, a number of different things came out from the federal government today. Number one, they're pushing for folks to move and start offering the vaccine to those over 65 and with health conditions. That's already in our 1C, which we are rapidly working towards moving to. We believe what they're pushing out falls very well within the plan that we have. One of the only changes is that differences is that we're getting police and firefighters done really quickly right now and with some priority, and then we're getting it out to our public schools as well. But basically all those changes are already in our plan. On going ahead and providing more vaccine instead of holding back the second dose, what it should cause is almost an immediate, when they do it, surge, meaning we will get a lot more each week for a certain period of weeks, but then it'll go back to the old manufacturing amount. In other words, we will have less vaccine coming in after they get out the reserve they were holding back. Our challenge in planning is we have to make sure people can get those second doses, and being really careful when the big amount comes in, that if we immediately vaccinate everyone with that, which is what we want to do, is there going to be sufficient amounts 3 or 4 weeks later to get that booster shot? And that's what we're working on right now. I think it's good to go ahead and to push these out, but we've got to do it wisely, and we can't put people in a situation where they can't get the second shot. Shelby Smithson from WKYT.
Hi, Governor. There are reports that some larger communities are having trouble keeping up the same vaccine distribution pace as smaller ones just because of sheer population. Are there any options for help to make sure those communities stay at the same level?
So we're having to adjust allocations as we send them out in the state to get closer to population. So one of the reasons that you've seen some communities be able to move to 1B or 1C is they got more vaccine per their amount of population than many of our urban centers or other areas. And that's because we were targeting where hospitals are, and we got a lot of rural hospitals and in our Commonwealth. So that's something that we are right sizing right now, but it's a good problem to have as long as people are getting the vaccine out. I have one question here that fits into this. And let's remember that we have two directives. We want people to follow the priority list, but the most important thing is we want 90% of all doses that they get in people's arms in that week. So that means that in some areas, or even maybe just in parts of some weeks, that you're going to see in different parts of Kentucky movement into different priorities from 1A to 1B to 1C. And we're going to have to do that. And we're going to have that flexibility if we want to vaccinate quickly. And the faster we can get to 1C, the better because of how large the group is. And we're, again, on Thursday, I hope, going to have a major announcement on how we're going to handle that large group efficiently. Here's a question from the Herald Leader. As of yesterday, only 22% of the vaccine received by long-term care facilities has been administered. So we under our federal contract, under the federal contract, because it's between the federal government and Walgreens and CVS, to activate the program, we have to send certain amounts to Walgreens and CVS, even though their pace might not be the same as the pace that we are setting and improving on here in the Commonwealth. We can't pull those back after we activate the program to some other areas we're moving faster. So right now, I believe they have allocated to them and sent to them all the doses they will need for the first round of vaccine shots. And we had to go ahead and do that, even though it's going to still take some time for them to get to every facility. But no doses have expired that I know of. And CVS and Walgreens have committed to picking up their pace. But the reason you see just such the different number there, as opposed to the amount we're doing and how quickly on our state-run programs is what we were required to do to activate and comply with the terms of that contract. Al Cross from the Kentucky Health News. Al can tell me if I explained that well.
Thank you very much, Governor. Two questions. You said, speaking of the impeachment petition, now we're supporting this afterwards. Are you taking the appointment of a committee by the House to be support, or what did you mean by that?
Oh, I just mean that if the committee moves forward with it. There's an argument you've got to form a committee under law. In the past, that hasn't happened. They've just sent it to an existing committee in state government, and if it had no merit, nothing else was done. That's the process that a number of these have previously followed. I haven't seen, though maybe they did with Judge Gentry, the formation of one of these. And it's a concerning precedent depending on what they do, because if a person out there making videos of smiting people with his handgun in clear sight can file a petition and create a real spectacle, my goodness, how many of these are we going to see, and to who and how? But the committee hadn't even met if they're going to meet. And so, no, at this point, I don't think that they are supporting it. But again, we cannot spend our time lifting up those who try to create and cause terror in our country. It is incredibly dangerous, and we've already seen what happens when you do it. Al, did you have one more question? You'd said two.
Yeah, the other question was that you said in regard to the federal changes, all those changes are already in our plan, but they're calling for 65 plus, and our next phase is 60 plus after the 70 plus.
You're correct. We're going to go ahead and do 60
to go to 5 or 6.
I'm sorry I interrupted you, but we're 60. We're a little more aggressive in how we're planning on doing it, but you're exactly right. Karen Czar from WKY.
Good afternoon, Governor. Hello, Virginia. As far as the booster program, I know we're early into it, but in the trials, some of the patients were saying that it was the second shot where they were feeling a little bit unwell just for a day or two. Are we getting reports of that yet? And I also don't remember if you have gotten yours yet, and if so, how are you feeling?
I've not gotten mine yet. My 4 weeks comes on the 19th, I believe, but I'm feeling great. We have not received reports of any significant of any. I haven't received a report of any problems coming out of the booster shots. To me, that says there haven't been significant ones, but we will check to see if any have been reported to date. Sarah Ladd from the Courier-Journal.
Yep. Good afternoon. Thank you. So I guess it was last week at this point where I had asked if the state was looking at any new restrictions because of the high numbers, and I believe you had said, we got to wait and see if it's related to the holiday or if it's a much larger bump. And as we approach the 2 weeks out from New Year, what are you thinking as far as, is there any plans for new restrictions, or kind of what are you thinking about that? Thank you.
No plans at this time. What it looks like, and again, it's really hard to tell because we had some reporting irregularities when labs were off and others, but it looks like that we have jumped up, but we may already even be stabilizing and wanting to see what's going to happen. Now, it could be that we are still in the increase. It's not clear yet, and we're going to want to make sure that we see more data before taking any action, none of which is under consideration at this time. And it's both the positivity rate and what we're seeing in some of the day-to-day on the cases. So we'll be looking at what this week is like compared to last week, which was certainly high. And we may have to see what next week looks like too on where we're going. Certainly the White House is describing a high plateau. I believe that's where Dr. Birx thinks we are right now. The question is, we believe it was created by we know it was created by holiday gatherings primarily, but we're still trying to determine what people have been doing since, and that'll be borne out in the numbers. Stu Johnson from WEKU.
All right, Governor, thank you very much. This may be a question a little more for Dr. Stack, but let me ask you, and in your conversations with him, you may have talked some about this. When you consider the risk of transmission of COVID for the home setting, where you've talked about limiting numbers to 8 of 2 households, compared to, say, a big box store where people are properly masked, or a Rupp Arena or a Yum Center, does the risk of transmission lessen with the larger facilities?
Well, it's the activity that's entirely different. So when you go into a big box store, you don't stand in close proximity with anybody for 30 minutes, 40 minutes, 50 minutes. You don't take off your mask. You don't eat and drink. It's not a familiar setting where you're hugging on somebody. The home gatherings, what you see is that it's the type of place and activities where all the rest of that occurs. It's the difference between transient contact, which is short, and extended contact. And I think when you look at some of the studies out there, whether it was one on restaurants or others. It's the places that you are, say, an hour and in close proximity. And that's why we know at this point that those activities cause spread at a much different rate than say a big box store. Now, many of the big box stores have much larger space, which again allows you to distance more, and you don't see a lot of distancing at private home gatherings, and also oftentimes have industrial ventilation systems that you can do a little bit more with. And if they're doing it right, they're making everybody wear a mask when they come inside. Now, what Ruperino or the Yum Center or Lynn Family Stalker Stadium have are enforcement, which should be happening in retail. And they've been pretty good about this, about, maybe giving a warning, but you're not wearing your mask, you're out. And that adds a level of protection that thus far we believe has allowed those events to occur as safely as possible with some amount of fans. John Charlton, WHAS.
Hey, Governor, how you doing today? I appreciate you taking this question. Can you just give us a sense on what we're expecting to hear on Thursday with UI? And on top of that, we've gotten some emails about the phone appointments, which obviously is a good thing to have that service, but people are trying to get on these phone appointments and they're all taken up. They can't schedule into February or any other month. What do you know about that?
Well, I believe, and Amy's going to have to correct me on Thursday, that we're only scheduling a certain number of days at a time, and then we're going to reopen for appointments right after that. On Thursday, we'll give you the schedule so you can tell your viewers exactly when they should jump on to schedule it. We are limited by the number of people that we have, which is a challenge. It's 90-something individuals less than it was before some pretty significant budget cuts. We are diving further into our numbers, which you got a report on last Thursday. And there are a number of indications that 50 to 60,000 of the claims that are sitting there being shown as not having been processed are fraudulent claims. And we've seen huge amounts of fraudulent claims across the country. Many of them have been sitting months without, after reaching out multiple times to whoever that individual is or is not, and not having any of the identity information confirmed. That's one of the things they look for in that. But even if we put that to the side, if there are 30,000 people out there, and there probably are, that are still waiting, it's too long, and we need to get them scheduled, and we need to get them helped. Hopefully, this $1,000 payment that's going out should go out to virtually all of them if they don't fall into any of the categories that you worry about for fraud, and can help as we get that next appointment scheduled. I have one here from WSAZ about a 71-year-old man from Ashland recovering from cancer and struggling to get an appointment to get a vaccine because appointments are filling up so fast. As more becomes available, are we looking ways to make sure the most vulnerable populations are getting some priority? And we're always trying to refine our plans and the balance, and it's a challenge here, and this individual needs it, and we need to look at our programs for how we make sure that happens. Is the more you try to allocate one dose per one specific individual, the slower it goes. So we're going to be working on programs to make sure we can have large, high throughput vaccination sites, but also programs that would get out to individuals like this. It's thinking big and thinking small. But this is truly a plane we're building on the fly. The federal government just changed all their guidance today. But I feel very good about where it's going. I feel that we are improving every day. I'm still not satisfied, and it won't be until everybody gets a vaccine. But I feel like we've got the right plan, and I really hope Thursday is the type of day that I think it's going to be, and everything comes together. Many states are facing distribution challenges, can't get it out fast enough. I do not believe that we have any expired vaccine. I have not been made aware of any at all. With an increase of those over 65 and older to be vaccinated, how will the state keep track of who needs a booster and the time period for it? That's the challenge. It's not the challenge just by expanding the priority group. It's going to be the challenge getting all of this big push of the vaccine at once. But knowing 4 weeks from now, you're not going to have that same number of doses coming. And so this is a new challenge that was raised a couple days ago. We're gonna come up with the right solution, but it may be that for some of those doses that come in, it may have to wait a week to ultimately be administered, when we currently have our goal of 90% in 1 week. If we know that there's a large group of people that need a booster in that next week, and the amount allocated to us is not going to meet it. Now, there may be some things that happen that help with this. For instance, Johnson & Johnson, it appears that they are moving towards submitting for emergency use authorization. If that happens, and if they've got supply, you could see, because there's only one shot there, new people who qualify to be vaccinated getting that one, and being able to use more of what's coming into us for people's second doses. So it's, we gotta put this puzzle together, even though we don't have all the pieces right now, and even though we don't fully know what it looks like. But we got the right people on board. Thursday, we're also going to have an announcement on our project manager for it, and I think that'll further put people at ease. All right. That's today. We tried to do this a lot faster. Thursday is going to be a lot longer. So we'll see you at 4 o'clock on Thursday. Just remember to stay safe, wear your mask, and that now is a time for those who truly want to do their patriotic duty, to say no to the anger, no to the hate, no to all this. Never thought I'd see our U.S. Capitol stormed in my lifetime, and it happened. And it happened. So the question is what we do about it. What do we do about it? Do we say that this is not okay in America? And do we put an end to it now? Do we condemn this not just once, but every single day, and never support those who would engage in it? That's certainly what I'm going to do, and it's what we need you to do too. Thanks.